medicine and philosophy from January. So these are amongst those highly dignified and experienced persons who are very firmly devoting their efforts in Ayurveda promotion and awareness outside India. And definitely listening to them and to their opinions and views in today's topic is going to be highly enriching to all of us. So taking this session forward, may I request you all to please join me in seeking the blessings of Lord Dhanvantri through Dhanvantri Vandana.
शङ्खं चक्रमुपर्यधश्च करयो दिव्यौषधं दक्षिणे वामेनान्यकरेण सम्भृतः सुधाकुम्भम् जलूकामपि बिभ्राण करुणामृत सुखकर सर्वामयध्वंसक क्षिप्रं नो दुरितं छिनत्तु भगवान् धन्वन्तरि पातु नः नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दित पादपद्मम् लोकैर्जरारुग्भय मृत्युनाशम् धातारमीशम् विविधौषधीनाम् सव्योमवातावनिवारिवह्निम् पञ्चप्रपञ्चात्मक देहभाजम् सन्ताप सम्पात जराज्वरान्तकम् नमामि धन्वन्तरिमादिदेवम् नवीननीलमुदकान्तिकान्तम् शान्तं हरेर्द्वादशमाख्यमूर्तिम् पूर्तिं शतानां सुमनोरथानां नमामि धन्वन्तरिमादिदेवम् नमामि धन्वन्तरिमादिदेवम् नमामि धन्वन्तरिमादिदेवम्.
Thank you all. Now, after this divine prayer, I would like to invite Professor Maheshwar sir for the welcome address of this session.
Namaskar and very good evening to all. Respected Mahamandleshwar Swami Advaitananda ji, Professor Yogesh Mishra ji, Professor K.K. Dwivedi ji, Professor Govind Sahai Shukla ji, Professor Ashwini Bhargav ji, Vaidya Surendra Chaudhary ji, all the guest speakers from different countries, and all the Padadikari of Vishwa Ayurveda Parishad. As we all know that Ayurveda Day celebration are so much awaited by all of us, and on the occasion of which Government of India along with Ministry of Ayush has already announced to take many great initiatives at national level countrywide. Vishwa Ayurveda Parishad has also organized this today's international webinar following the same ideology, and in which we have invited those personalities who are in real sense contributing a lot in popularizing Ayurveda at their respective place in different parts of the world. So, in our today's webinar, I am feeling immense pleasure to welcome our distinguished guest speakers. First of all, Mahamandleshwar Swami Advaitananda ji, who is the founder of International Meditation Foundation. Swamiji is very passionately carrying on the various activity of Vishwa Parishad and has given new heights and popularity to Ayurveda and yoga amongst the people there in Canada. He has also been invited by the Honorable Prime Minister of India to propose new education policy, and he, because of his great and wide vision, has revised our new education policy in the lines of classical Indian culture and tradition. So it is a great opportunity for all of us to listen to his great and highly learned personality. I welcome Swamiji. Our next speaker is Dr. Aparna K, advisor of One Word Ayurveda from Bali, Indonesia. She has also dedicating her extra devoted efforts in creating awareness and popularity of Ayurveda knowledge at Bali. I welcome you, Dr. Aparnaji. Now I welcome our next speaker with the Gauri Junarkar. She is the director of Ayurveda Nutrition Wellness from Texas. And in spite being on the foreign land with different scenario, she is proudly practicing fulfilled Ayurveda and is also contributing a lot there in Texas. So I welcome you, Dr. Gauri Junarkar ji. Our next speaker is Dr. Michele Sahasa. He is the HOD in the Department of Samhita and Siddhanta in the Tribhuvan University in Nepal, and being the Sanyojak of Vishwa Ayurveda Parishad in Nepal, he is very actively organizing many activities in interest of Ayurveda promotion and disseminating Ayurveda knowledge and practice there in Nepal. So it is again going to be a great pleasure to listen to him. Now I welcome our next speaker from Sri Lanka with Padmini Damayanti Fernando. She is also actively providing her sincere efforts in the interest of Ayurveda and is keeping herself so active with full dedication in this regard, for which we truly admire her in these efforts. I welcome you, Dr. Padmini ji. Our last speaker is Dr. Neha Avasti, who is presently working as the consultant in Foundation University of Ayurvedic Medicine and Philosophy, and is also the Sanyojak of Vishwa Ayurveda Parishad in Germany. Very recently, she had been shifted to Germany, and in such a short span, she is actively involved in creating awareness of Ayurveda there in Germany, which is indeed a very appreciable effort. So welcome Dr. Neha in this webinar. I once again welcome all the keynote speakers who have been invited here from different countries of the world. It is going to be a great talk with you all. And now I cordially welcome our most dignified and highly respected members of Vishwa Ayurveda Parishad, motivation and torch bearer, Professor Yogesh Chandra Mishra ji, Vaidya K.K. Dwivedi ji, Professor Govind Shukla ji, Professor Ashwini Bhargav ji, Dr. Surendra Chaudhary ji, and all the other dedicated members of Vishwa Ayurveda Parishad. I also welcome all the faculty members, practitioners, PG, PhD scholars, and listeners who have joined with us in this webinar. Since today's topic is about mental health through Ayurveda, and definitely this topic and this particular area requires a lot of awareness and attention. As said by Acharya Charaka, Shariram api sattvam anuvidhiyate, sattvam cha shariram. To enjoy happy and healthy life, mental health do play a very, very important role. So in today's webinar, we all will listen to our highly learned speakers about the same, and I am very much hopeful that this webinar will come out to be fruitful to each one of us. With this, I once again welcome each one of you in our today's webinar. Thank you so much.
Thank you so much, sir. Since Vishwa Ayurveda Parishad has always remained proactive and very keen in organizing various activities in the interest of Ayurveda. So just to acquaint you all regarding all such activities, I would like to invite Dr. Surendra Chaudhary, sir, to give a brief introduction of Vishwa Ayurveda Parishad. Sir, please.
Thank you, Dr. Nikita ji. It's my privilege to introduce Vishwa Ayurveda Parishad, which is the largest organization working in the field of Ayurveda in India and globally. Start in 1997, we are celebrating our 25th year of establishment in year 2022. The journey was not so easy, but by the grace of Lord Dhanvantri and untiring efforts of VAP mentors, we are in a position that we have over 10,000 lifetime members and more than 200 international or overseas members. I'm happy to disclose that few of our today's speakers are our lifetime members, whether they are in India or abroad. VAP working among academicians, students, physicians, Ayurvedic drug manufacturers by organizing residential skill and personality development programs, which are spanning with 1 day to 7 days. So we call it as the traces. So we are working in all the field of Ayurveda. We are organizing residential camps for skill and personality developments, webinars, seminars, workshops with hands-on practice for different specialties like Agnikarm, Jaloka, Marma, Krepi, and particularly a unique thing, the Ayurveda in eye care. Publication of journals, organizing essay competitions for UG and PG students, Best Thesis Award for PG scholars, research methodology workshops, health camps for general public. These are the few of our regular flagship programs. We have one very unique program which was started in year 2015 with the name of Study Circle, that was started in NIA Jaipur. And since 2015, every Friday, this program is being held regularly without a miss. Even during the COVID period, this program was conducted regularly on an online basis. We also have some specific programs, like we conduct every month a pre-PG entrance mock test just to evaluate the PG entrants to judge their skills and knowledge. We have a long list of achievements and programs and activities, but the time is constrained and I don't want to be interfere with our audience and our learned speakers. So we welcome all the speakers and audiences in today's webinar. Thank you. Thank you very much for providing me the opportunity to introduce this, one of the unique organization among the field of Ayurveda. Thank you.
Thank you so much, sir. Undoubtedly, the untiring efforts of so many visionary and hardworking personalities and members of Vishwa Ayurveda Parishad are the reason behind the success of our organization. And much gratitude and respect to all of them. Now, taking the session forward, let me just take this pride opportunity to invite our first most dignified guest speaker from Canada, Swami Advaitananda ji, who is also the Mahamandaleshwar and the founder of International Meditation Foundation in Canada. Swamiji has already remained so much involved in popularizing in Ayurveda in Canada, as told by Vyas sir, through so many different activities and initiatives. And again, it is a delight for all of us to know that he has also been invited by our present Prime Minister, Honorable Narendra Modi ji, in giving new orientation to the existing education policy. So listening to such internationally known personality in today's webinar is a real memorable opportunity to all of us. And it is again a very proudful moment. So I request Swamiji to please enlighten us all with your words of wisdom. Swamiji, please. Kindly unmute yourself, Swamiji. We are not able to listen.
And, thank you, Dr. Mahesh Vyasji. I'm grateful to the World Ayurvedic Society for giving me an opportunity to be with you today on the auspicious day of the Ayurveda Day. If we look at the statistics in the world, the US CDC, the Center for Disease Control, reports that it is a report of like a week or so ago, 32.3% Americans are either facing anxiety or depression. The anxiety or depression straight away does not arise. For one to reach into depression, one need to be worried. And that worry need to be a little bit deeper. And then it need to take a form of some sadness. And then the sadness need to deepen, and then it will go into the multiple layers. And then it would reach in a state of depression. Now, if the 32.3% population is having depression, then at least 3 times more people are needed for one to be depressed. So if we multiply 32.3 into 3, that would be 96.9% population would be having sadness. If the 96.9, which is nearly 97% population is having sadness, that's really worrying. And that is the situation of world's most developed country, or the so-called developed country. The situation is pretty much similar of other countries as well. Like the UK carried out a census, and census is not carried out every year. It is after like 5 years or so. And that also reports that the 21% population of UK is facing either anxiety or depression. Similarly, in 2010, Canada's Mental Health Commission reported that 1 out of 5 Canadians is facing or taking the treatment of mental health. Now, there was a data which is above the age of 40, 50% Canadians are taking mental health treatment. Now, this is the situation of the world. Then we need to look at that. What is going wrong? What we have missed, that there is so much of sadness or worry or the misery in the world. One thing we can say that natural elements like Ayurveda are not utilized. The treatment which are these days we are using has a lot of side effect, and the very fundamental of our upbringing is not natural. The very fundamental of upbringing or our education is driven on the basis of intellect. That need to be changed, and the very fundamental of education need to be of love, truth, compassion. The human values and the life skills need to be part of it. We have in the National Education Policy 2020, we have brought the universal human values and life skills in it, and which is a great step forward in transforming the education system of India. The National Education Policy is the one which can, if it can be implemented rightly, don't take me in a exaggerated words, but that could create heaven on earth. But as you know, the policy is as good as we implement it. And that requires contribution and skills from all of us. This body, the Vishwa Ayurveda Parishad, and a lot of our Canadian friends are also in this, so I will translate the name for them in English, is the World Ayurveda Society. Is one of the largest body of Ayurveda and has most dignified Ayurveda Ayurveda doctors, or I would say the Vedyas in it. We need to give our skills for the National Education Policy in which Ayurveda can be part of the day-to-day life. So at the moment, whatever the curriculum being built, it is optional, and that optional hardly nobody teaches, so it is not effective. That need to be made practical, and there would be time when every period, one period would be dedicated in every school, every day, for learning how to be a good human being, which is very fundamental of Ayurveda. And also Ayurveda should be part of it. Other things which are being taught, that should also be in line with the life. So that should not remain only a theoretical material. Whatever else being taught, that should be in such a way that connects with the real life. And that inclusion, I would love to work with the World Ayurveda Society and get it implemented in the in our curriculum of the Indian system. I did give a talk to the Parliament of Canada and in the provincial Parliament of Ontario. And people are very open over there if we present them something which can be used and not make it any type of particular pathy or so, and it could be something which is more like directly which helps them. Then it does not get branded like that, and those other pharma companies and also don't go behind. Then these things are very, welcomed if it does not get a tag in the West. But yes, in India at least, we should have Ayurveda in the curriculum of the children, and everything like Ahar, Vihar to Ritucharya to Dincharya to Rasayan Chikitsa to Marma to Nadi Chikitsa. Everything of Ayurveda in whichever way we can include in it. That's one aspect of my talk. The other aspect is where I could add some value to the great Vedyas which are present over here. I did work intensively on the Kuti Praveshikam. I do carry the tradition of Sriman Vishnudas Udasinji Maharaj of the Kuti Praveshikam, the saint who lived 185 years. His famous book on Kuti Praveshikam, many of you must be aware. That tradition, yes, I can share with with you in whatever detail you want. And also right now, I would like to share my experiment of Kuti Praveshikam and how that aligns with the mental health and what can be done in using that Kuti Praveshikam knowledge to more and more people. Because in the whole world, we only have like few kutis where this experiment can be done, and we need to come up with innovation. We need to spread this knowledge and utilize it. The conclusion of my last Kuti Praveshikam was that my sorrow disappeared, and that is a huge thing, that your sorrow disappears in the Kuti Praveshikam experiment. The rasayana I used was the Palas Amalki rasayan, and the second one I used was the Neel Kamal rasayan. So every day I used to eat the same Palash Amalki rasayan. It was, the quantity was 100 gram and rest was milk. No shower for those 7 months. And the structure was like 3 layers. So one room inside, second room inside, third room, and you can't even see your own hand. It was so dark. Now that takes us inward, and this type of experiment brings us very center to our being. And when we go as deeper to our being, we cut from the mind, we cut from the heart, and then go even deeper from the heart to our hara, which is the center of our being. And once we are into that space, then no question of mental health issues. So this is just to show give you an idea that how the Kuti Praveshikam goes so deep that it can cure the mental health issues faster. Obviously, we have to be careful when we take the people in, that there should be training. And the method which I use, like I used to sit 12 hours in meditation, and previously, whichever the experiment were done in our ashram also, we did many times, mostly in 3-4 days, people comes out. So we need to work together, that meditation get tightly integrated, mantras get tightly integrated with the Kuti Praveshikam, and then this is offered. So then the chances of its success will increase substantially. Because this Trigarbha is like how we live in the mother's womb. We are living over there. And in that state, if we can train the mind, then it goes very fast and very deep. So the benefits are, like let's say the sugar, if somebody has the diabetes, and if you are treating its sugar problem, if you do the same in the Kuti Praveshikam, that could multiply so many times more, faster. So this is the one thing I would like to add, which I would ask the Ayurvedic community to work on it, and whatever from the tradition of Vishnu Das Udasinji Maharaj I'm carrying, I'll be happy to share that wisdom. For the mental health, the way we work is the 3 things. One is the purification of the body, second is purification of thoughts, and third is purification of the mind. The emotions. So thoughts and emotions, one category mind. So these 3 are on the purification part, and then we go further in separating the body and soul. Like we read in the Shastras that we are not the body, we are the soul. But if somebody just slaps us once and then again suddenly the anger arises, or somebody says something to us and then a trigger comes, if we are reacting, if the emotions are coming like this, then we are still in the body, we are still in the thoughts, we are still in the emotions. So for the mental health, it is important that we go beyond these and separate ourselves from the body. So there are methods related to that. So that would also work with the Ayurveda and treatments. And of course, there are all these are part of Ayurveda. Some are known, some are lost. Other than separating from the body and the soul also need to be separated from the thoughts. And the last thing is, the 6th thing is separation from the emotions. Now, as you know that the thoughts are on surface and emotions are deeper. So when the thought get deeper, then that takes the form of an emotion. So we also do the work on purifying those thoughts and purifying later on those emotions. So when we purify the body, when we purify the thoughts, when we purify the emotions, that's one level. Then we go in the next level, separating ourselves from body and separating from thoughts and separating ourselves from emotions. So the soul is disconnected or separated from body, thoughts, and emotion. That's the second level of leap. When we do these 6, then we are into our center of our being, and then things won't shake us like the way they do right now. So this work can be done in tight integration with the Ayurvedic medicines, and I'll be very happy to be volunteer for the World Ayurveda Society, the Vishwa Ayurveda Parishad, wherever required. So thank you once again, and I'm so grateful to the Vishwa Ayurveda Parishad for having me today.
Thank you so much, Swamiji, for sharing with all of us your valuable experiences and your own experiments in promoting and redressing the mental health and related issues, and also for refining our understanding even more deeper and clearer. Hope to listen you more and more in our upcoming sessions as well. And also we are very thankful that you've accepted our invitation for enlightening our listeners. So thank you once again. Now, moving forward, I would like to introduce and invite our next international speaker from Texas, Vaidya Gauri Junarkar Madam. She is the Director of Ayurveda Nutrition and Wellness, as told before, and has been engaged since so long in popularizing and spreading awareness about Ayurveda there. She has engaged herself in many different ways in disseminating knowledge regarding Ayurveda and is contributing a lot in this regard. So, ma'am, I now request you to kindly enlighten us further on today's topic.
Thank you so much. And first of all, I would like to thank the Vishwa Ayurveda Parishad for inviting me and giving me this opportunity on a very important topic, which is the need of the hour, which is mental health. And again, Swamiji, listening to Swamiji's enlightened words, definitely he put a lot of emphasis. One, definitely he talked about in some of the statistics and things, and then what can be done and how Ayurveda can be integrated. So thank you so much, Swamiji, for enlightening us with the wonderful words. Now, with mental health and what we see, especially here in the United States, one of the biggest triggers we find when it comes to mental health is stress. And I'm going to talk with regards to how we can actually manage the stress better through our Ayurvedic diet, our ahar, as well as some of the Ayurvedic therapies that can be included, and we include here as well, and the wonderful results that we see as well. So when it comes to Ayurveda, we know our everything is through our gut. We give a lot of importance on Agni, and the most important shloka that we have that summarizes everything, right, for us: samadoshaha samagnishcha samadhatu malakriya prasanna atma indriya manaha swastya itbhidiyate. That means Ayurveda puts a lot of importance on the mind and body connection. What affects the body affects the mind, and what affects the mind affects the body. So then what can we do to achieve that balance? We can achieve that balance through a 3-way process. One is focusing on our diet, which is our ahar, including some of the Ayurvedic herbs, and again, adding some of the Ayurvedic therapies. Let me take a moment to also talk about stress management, because stress is an important trigger. And we find that, with increased stress, we see increased inflammation. And a lot of times that is one of the root causes for a lot of the different chronic disease states, and the risks increase significantly. So what is stress? It is the body's way to react to any kind of demand. We see emotional stress, a lot of physical stress. And what is the effect of stress? Anxiety, fatigue, upset stomach. And we know that the root or where we feel that stress, where we feel those butterflies is in the gut. We are aware of the gut-brain axis right now, and we see a lot of emphasis on the gut theory, on making sure that our gut is functioning well. And that is what Ayurveda has been talking about for thousands of years, is making sure that, again, our Agni functions really well. So we also see the effect of the stress on sleep. A lot of times there's overeating, there's higher risk for hypertension, heart disease, obesity, diabetes. So one of the things let's also talk about is ahara. So the three types of ahara when we talk about, which focus on especially the gunas, we have the sattvic, rajasic, and tamasic. So when it comes to the sattvic ahara, again, it's considered more balanced, less stimulatory. It helps increase the calmness and mental clarity, easy to digest. Some of the foods, when you think about the sattvic ahara, the fresh foods, definitely emphasis on fresh foods, fruits, vegetable, honey, milk, yogurt, buttermilk, making sure that we understand what is the rajasic ahara, the food that is more considered more stimulatory. You could say that foods that are more pungent, hot, high in salt, sugar, and dry, a lot of fried foods are considered more of the rajasic. So again, reducing less of these in our diet. And then when it comes to tamasic ahara, which is considered very heavy to digest, a lot of time creates more feelings of laziness, makes a person more sleepy, decreases clarity of thought. A lot of times the stale foods, that means food again that can increase more ama in the body. Deep fried foods high in fat and sugar, salt, a lot of time meats, alcohol would be considered more of the tamasic. So again, reducing some of this in our diet would definitely help. And again, identifying when we have different patients, different client, understanding again where that the stress is coming from, understanding that if this particular person is eating according to the prakriti, again understanding what the prakriti is and aligning those foods according to the prakriti as well. When it comes to some of the anti-stress techniques, yoga, pranayam, sarvanga abhyanga, Shiro Abhyanga, Pada Abhyanga, Shirodhara. Again, these are wonderful anti-stress techniques as well. Some of the things that we definitely recommend here as well. Some of the Ayurvedic herbs that we really have found a lot of help with and really have benefit with when it's a combined approach, Brahmi, Shankapushpi, Tamansi, Ashwagandha, Guduchi, Yashtumadhu, some examples of that. When it comes to therapies, let me take a moment about talking some of those therapies as well, especially Abhyanga. So we know when you can think about the Sanskrit definition, Abhi and Anga. So Abhi is an ointment and Anga is basically the body. So massaging the body with the oil for general well-being and therapeutic use in different health conditions as well. So some of the benefits we have seen with Abhyanga is again helps, especially it helps to pacify that imbalanced VAP, helps with relaxation, great immunobooster, revitalizes the mind and the body. And what we have seen, especially for people with chronic diseases, something like diabetes, weight management, weight issues and things as well. When we include a lot of these Ayurvedic therapies and the ahara as part of their wellness plan, we see a lot more profound effect. One of the examples I will tell you is that, especially for people with diabetes, we have them test their blood sugars before and after a session of Abhyanga. And we see significant reduction, at least 30 to 40 points after a single Abhyanga as well. So that's how effective it is when it comes to, when you think about, the stress management part and also the benefits as well. The Shiro Abhyanga can be done as well, helps relax the mind, helps pacify the vata, revitalizes the mind as well. Shirodhara, again, helps a lot, especially pacifying all the three doshas, very calming, improves sleep, especially, reduces the stress effect. And I do want to share a few research studies as well that I came across in my study. So one particular research study I came across, this was a pilot study that was done way back in 2011. And this was done on Abhyanga and the effect of stress. And what they found is that it clinically significantly reduced the subjective stress, lowered heart rate, lowered blood pressure in a pre-hypertensive group. The next study looked at the role of Panchakarma in pre-diabetes. Now, why I talk about these is basically because a lot of times, these are a lot of the chronic disease states. So again, helping and adding the stress management definitely is a more holistic approach, a more wholesome approach. Abhyanga and Sweden was used as Purvakarma, and they looked at the BMI, the fasting blood sugars, the postprandial blood sugars, cholesterol, the triglyceride levels, and patients showed a good improvement in all the parameters. The third study I came across was on Shirodhara, and what they looked at is how sleep would actually, with Shirodhara, how sleep would be could be impacted. And what they found, the factors evaluated was sleepiness, the sleep-awake schedule, the sleep quality. And what they found that the Shirodhara was very effective in reducing stress, especially in insomnia. So this showed that Shirodhara could be used an effective and non-forming habit and as a safe sleep aid. And the last research study I came across was, again, looked at, again, Shirodhara and the effect on the vital parameters. They looked at the respiratory rate, the pulse rate, the blood pressure. And after Shirodhara, the participants showed a significant reduction in the diastolic and the systolic blood pressure and the pulse rate. So this particular study actually showed that Shirodhara could be an effective tool in maintaining the homeostasis in the body. So then when you think about achieving balance, as I said, it should be as a more integrative approach. We definitely need to focus on, again, nutrition, our diet. We also want to focus on the lifestyle, making sure that, you want to focus on the sleep is an important part. And in Ayurveda, we know that sleep is an important pillar of health. So our ahar, our vihar, our sleep, as well as including some of the Ayurvedic therapies like, Abhyanga, and also including yoga, pranayama, would definitely help a lot. So in conclusion, I would say that, the Ayurvedic diet, the Ayurvedic therapies, as well as including a lot of some of the techniques like yoga and pranayama, these could be effective tools in optimizing the health and reduce stress and reduce any risk factors for chronic disease states. So I feel that when it comes to our mental health, we definitely need to focus a lot on stress management, and we need to start including that as an integral part of our wellness plan. And with that, I would conclude my talk today.
Thank you so much, ma'am, for explaining this very important topic with so much crisp and complete explanation, including almost every important aspect that is required to be followed. Thank you, ma'am. So before I just invite our next speaker, may I please request to kindly complete your talk within 5 to 10 minutes so that the session will not get much extended. So it's a kind request to all the upcoming speakers. And now I take this opportunity to invite our next speaker, Dr. Aparna K. Madam. Madam is an advisor in One World Ayurveda from Bali, Indonesia. And she is also serving and practicing Ayurveda in her own successful way in Indonesia. So ma'am, kindly proceed with your deliberation.
Namaste. Thank you for inviting me. Dignitaries on the screen, and I'm very glad to share the screen here. So I really feel that I'm very blessed to help and heal many people with Ayurveda. And I feel that less than 5% of the diagnosed patients actually need chemical drugs. And Ayurveda can heal with simple diet, lifestyle changes, herbs, and through simple asanas, pranayama, meditation, listening to chantings. And this helps to develop a mind-body awareness. And within a month or two, there is a drastic improvement in in many of the patients. And when I did my PhD, I did a comparative study between the medicine, Ayurveda medicine, and the next was yoga. So what I found is that when a patient is struck with chronic anxiety, some of them were not able to do the practices. So we need some kind of herbal support, herbal medicine support to start with when we deal with chronic anxiety or depression. And then once they are in the track, then we can slowly withdraw the medicine, the herbal medicine, and then they can sustain the result with by doing asanas and all. So we need a combination of approaches. And I think as doctors here, most of us are doctors here, we need to develop our own practice, our own personal practice, so that we will be able to understand what kind of impact these treatments and these chantings and asanas and pranayam is having. And the beauty of our ancient wisdom is that we are not suppressing or asking the patient to express the emotions or the thoughts they have. We are helping them to transform by developing the awareness. And that is an important life skill and tool which yoga and Ayurveda helps in this is like a life jacket. So just by giving some chemical herb or drugs, anxiety and depression or mental health cannot be achieved. It needs the skill, it needs the life skill, it needs the person to get empowered. So we need to empower them, not just to make them dependent on any kind of, just like, even if it is herb or even if it is like any treatment, we need to reverse the process. And empowering is, as an Ayurveda doctor, our duty is to empower the patient, not to make them dependent on any kind of therapy or herbs or even us. So this can be achieved totally with the help of Ayurveda and yoga when combined in a very skillful manner. And the beautiful explanations of swastha means happy and peaceful in one's own natural state of being. And when the patient starts identifying the natural state of being, the happiness in oneself, that whatever anxiety or depression or challenges he has will start living them. So in Ayurveda, the concept of Adhyatma Dravya Guna Sangraha is told by Charaka, and he has beautifully explained that harmony of elements or Dhatu Samya is the aim of Ayurveda or Karya of Ayurveda, and he does two aspects. One is a spiritual or adhyatmika aspect, and the other one is laukika or material aspect. And unfortunately, we doctors are not giving importance to the spiritual or adhyatmika aspect in our practice. But my humble request is that we need to reintroduce that spiritual or adhyatmika aspect in our patients' life. So along with herbs and medicines or treatments, we need to introduce this kind of practices. And quickly, I would like to take you to this modern outlook, Western medicine outlook, where the contemporary field of research says that there is a positive stimuli and a stressful stimuli. So this relaxation response which these practices can give the body is immense, and that is why mind-body medicine is an emerging tool or emerging new science where the positive influence of mental functions, emotions, and physiology are learned. And whenever we open any chapter on disease in Ayurveda, we see chinta, bhaya, shoga, all the mental factors. And I used to wonder, why is it here? But as when I began to practice, and when we go to the nidana of the vyadi, we can identify that anxiety, alienation, hopelessness, they are not just feeling, they are disease like obesity or diabetes or anything. So when a patient comes to us and tell us that, oh, I'm feeling hopeless, I'm feeling anxious, it should not be ignored. So we need to empower them to transform those emotions. And as it is beautifully put in the Western medicine, that the neuroplasticity, there is something called as a positive neuroplasticity and negative neuroplasticity. So when we are asking the patient to chant, listen to chantings, ask them to do some upavasa, vrata, prayashchitta, these are actually paving new neural pathway in the brain. So when we are asking them to listen to the chantings, so there is a neural pathway change. There is a change in the brainwave pattern which is happening. There are so many good chemicals which are getting secreted in the brain, like serotonin, dopamine, anandamide, oxytocin. So there are a lot of transformation which is happening in the mind, and this is called as mind gym. So the mind, as our body needs a gym, mind also need a gym. So all this Deva Vipashriya Chikitsa, which is told in our classics, Sattvavajaya modes of treatment, which is told in our classics, is definitely a mind gym. So along with the diet and lifestyle changes which we ask our patient to do, along with the herbs, we need to start training them in this mind gym, right? So and we all know that each emotion have a different bodily expression. Like stress, when we are scared, we feel butterfly in our stomach. When we are sad, we feel throat gets choked. So different disease have different manifestation in our body, and each of this can be tackled with Ayurvedic techniques and yogic techniques. And we need to revise, and we need to go back to our textbooks. We need to practice ourselves, and we have to select the best out of these techniques to empower our patient. And I think only less than 5% of the diagnosed patients of mental health challenges need medicine, and rest everything can be cured with Ayurveda, is my experience and my belief. So with this, I would like to conclude my talk, as the time is less, and I would like others to hear other speakers also. Thank you for this opportunity, all the organizers, and namaste to Swamiji. Thank you.
Thank you so much, ma'am, for this informative talk and enriching our understanding more efficiently. I know this is a very vast topic, and speaking about it in just 5 to 10 minutes is really a very big task. But please accept my apologies, as we have the foundation of the time also. So I apologize for that. Now, let me just invite our next speaker, Dr. Michele Sahasa. Sir is HOD in Tribhuvan University, Nepal, and is also the Sanyojak of Vishwa Ayurveda Parishad there, and has been giving his dedicated duties in the field of the Ayurveda, and is also contributing a lot through his great vision and efforts for Ayurveda in Nepal. So let us all just welcome Sir for his insightful deliberation on today's topic. Sir, please.
Thank you very much, Nikita ma'am. Namaste and good evening to all. Sorry, I could not share my screen as I am not feeling well. But warm greeting from Nepal, the place of Pashupatinath, and wish you all for the Arogya world. First of all, I would like to thank Vishwa Ayurveda Parishad for making me the part of such great awakening webinar for Arogyata in the prevalence of, in the perspective of mental health. And congratulations all of you for the great effort of 25 years. We have really done a lot, and much more is to be still done. Thank you, all of you, for such great effort. Mental health includes emotional, psychological, and social well-being, as we all know. But it also helps to determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life. I used to say it's from childhood to the adolescence and till the death, it always affects throughout our life. So we can say that mental and physical health are equally important components of overall health. While going through the data of Nepal, it has suggested that the prevalence and disease burden of mental disorders has remained incredibly high, not only in Nepal, but also throughout the world, as our previous speakers have told us. But around 76 to 85% of people with severe mental disorders in low and middle income countries receive no treatment for their mental health conditions are being observed. The magnitude, the burden regarding disability and cost for individual, families, and societies due to mental disorders are the sticking factor in Nepal. Multi-sectorial action plan has suggested that the prevention and control of non-communicable diseases that was given between the years 2014 to 2020, and it estimated that 18% of the NCD or non-communicable disease burden is due to mental illness. But such finding triggers me, and what was found that this finding wants to share was not clear. Why such burden of NCDs are increasing? There was no answer. I found its answer in Samhita itself. While going through the verse in Charak Samhita, in most of the disease condition, mental status of Acharya Agnivesh or status of their disciples or Shishya were given in the starting of the chapter. For the reference, I would like to share the Prameya Chikitsa of Charak Samhita, where the chapter is being started with Nirmohamana Anusayo Nirasaha Punarbasuh Jnana Tapo Visala. The mental status of Acharya Punarbasu has been given. And the verse is followed by Asya Sukham Swapna Sukham that we all know. This particular reference suggests us that there is something from the mental status we have to think, which is to be also understood in the form of hetu. Not only the hetus what are given in the verse is enough, the mental status is also being suggested that this particular condition will not let you to be the pramehi. I would like to explain it with an example of Bhagavan Krishna. We all know it, him, we used to say it as a Makhan Chor. That means maximum amount of Makhan or butter was being used by Bhagavan Krishna. And with all the hetus, what is being explained in the Prameya Chikitsa, it suggests that Bhagavan Krishna is to be the first one who was a Prameya Rogi, but we don't find such reference anywhere. And it is only because he was with the mental status of Nirmoha, Anusaya, Niragaha, and also Tapasvi. This particular example certainly suggests that mental health status are directly proportional to the disease manifestation. I used to say in my class, "Jaisa khaoge ann, वैसा होगा मन," and there I used to add that जैसा होगा मन वैसा पकेगा अन्न, means your activity will also be followed by the mental status. Not only the anna is triggering your man, but man is also affecting your activities. Without taking much time, I hope my thought regarding the Samhita in the concept of mental health would have each in the right way, and my Guru will certainly declare these all things whether this is in the right way or not. I would request you all that there is need of assessment of Manas Bhava along with Dosa status, which help practitioner for getting health in every aspect. And it is need of time for the awareness in this sector. And for this, I would again like to thank Vishwa Ayurveda Parishad. In Nepal, we are working in the way of dhyana for relaxation and also for emotional, psychological, and social well-being. At last, I would like to thank Professor Dr. Mahesh Vyas sir and all the dignitaries of Vishwa Ayurveda Parishad for giving me the opportunity to be the part of this particular Must Awakening program webinar. Thank you. Thank you very much.
Thank you so much, sir. First of all, sir, we really appreciate your dedication for this webinar, that in spite of not feeling well, still you have joined with us and enlightened us so efficiently on today's topic. Thank you so much, sir, for this. We really admire and acknowledge your sincere efforts, and just praying for your speedy recovery and good health. Thank you, sir, once again. Now, taking the session forward, I would like to invite our next speaker, Dr. Neha Avasthi. She's the Sanyojak of Vishwa Ayurveda Parishad in Germany and has been contributing in the field of Ayurveda in her own way in Germany. I now request Dr. Neha to kindly enlighten us all on today's topic.
Thank you, ma'am. Very good evening to one and all, and my regards to all the dignitaries, fellow speaker, and dear listeners. Myself, Dr. Neha Avasthi, and Philosophy, Germany. As the theme of today's webinar is mental health through Ayurveda, so I would like to highlight its importance first. Every year we observe 10th October as World Mental Health Day. As we all know, people who are suffering from mental health issues faces stigma, discrimination, and lack of opportunity. So the World Mental Health Day is an opportunity to collectively raise awareness about the mental health issues. Mental health is not just being the lack of mental illness, it's about overall well-being and the proper functioning of an individual. Even in Ayurveda, a person is healthy when there is a balanced coordination of body, mind, and consciousness. When we talk about the number, as per WHO, 20% of our youth is facing some kind of mental health disorder, and the half of them have developed some kind of mental illness before the age of 14 years. So, and this mental health crisis increased even more after the pandemic. So I would like to highlight this problem, that there we need to create awareness about the mental health issues, because especially in India, people faces a lot of stigma related to mental health. They don't talk openly about it, or they feel ashamed about it. But when it comes to the physical problem, nobody feels ashamed. So, and when it comes to Germany, everybody is so open about mental problem and mental challenges they faces, and they take proper care of it. So the proper treatment of mental health disorder are not possible until or unless we create awareness about the topic. Ayurveda can contribute in this area through its unique concept of Manas Prakriti. Manas Prakriti is an important tool which can be used to understand the psychological makeup of a person and what kind of psychological challenges come along with it. The concept, for example, in my thesis work, I was doing a correlation between Manas Prakriti and psychosocial related disorder. So in my thesis, I found that the individual with Tam Pradhan Prakriti are more prone to develop psychosocial related disorder, and those with Raj and Tam Pradhan Prakriti are more prone to develop like they have less coping capacity and they are less optimistic in the difficult time or in difficult situations. So the examination of Manas Prakriti is an approach to comprehend the overall psychological traits like behavior, liking, disliking responses, and can be used for the maintenance of mental health through Ayurveda. In Ayurveda, in Germany, we also take classes in which we talk about or we teach them the basic concepts of Ayurveda regarding Dincharya, Ritucharya, Ahar, which can be used to maintain a healthy body and mind. We also include topics of philosophy. We also talk about the topic like karma, man, praman. So this when we talk about these topics here in Germany, so people actually listen to us and they feel very relaxed, and that this group classes work as a therapy for them. And this has reported by so many our patients who come for the classes that they have found that there is a decrease in anxiety, and there is enhance of their mood. So in Germany, we don't have access to a lot of Ayurvedic medicines. So when a patient come for anxiety, I also recommend them to do chanting of mantras. So because of the language barrier, I told my patient to play mantra and sit calmly and work on their breathing exercise. And I found a significant amount of improvement in anxiety, and I found that there has been an enhancement of their mood. So in Ayurveda, there are a lot of concepts which can be used to promote the health of the individual or mental health of the individual. But what I felt that these are the three basic things which has been ignored for a very long time. When a patient comes to us, we do take check their physical traits, we do analyze their sharirik prakriti, but we don't really care about their manasik prakriti. And when it comes to the chanting of mantra, it is a practice which can be done anywhere and it can be done at home. So these are the concepts which I think are not generally practiced and are generally ignored. And beside this, we have a lot of other therapies also. We have Shirodhara, and we have Panchakarma, Sattvaja Chikitsa. But I wanted to talk about these topics or these points because I feel these are most ignored. So I would like to conclude my thought about the topic, and I would like to thank for providing me this opportunity to express my view. Thank you so much.
Thank you, Dr. Neha Vasti. It is so much delight to see you working and your dedication to take Ayurveda to new heights and recognition in foreign land, and also for your great understanding about today's topic. It is definitely so much informative to all our listeners. Thank you once again. So a big thanks to all our international speakers who have shared with us their valuable opinions and views on today's topic in such short time slot. And we are definitely looking forward to listen to them in our future sessions as well. Now, as a token of gratitude to all of our speakers, I would like to invite Dr. Rupa Bhatta ma'am, she is a principal in Dhanvantri Ayurveda College, Siddhapur, Karnataka, to propose a vote of thanks.
Sarvebhyo Namaskaraha. So I'm really proud to say that I'm the member of Vishwa Ayurveda Parishad, and really I'm thankful to the organizers because through with this platform we are meeting the many eminent scholars, and also our experience, their experience really boost our confidence. And today's speakers, really, it was very good, informative, and it has enhanced our confidence to practice. So I'm thankful to the organizers first, and it gives me an immense pleasure to thank all our the today's speakers, and a great pranamas to Swami Advaitananda Guruji as founder, International Meditation Foundation. Thank you very much, Swamiji, on behalf of Vishwa Ayurveda Parishad. And heartfelt thanks to Gauri ma'am, a director at Ayur Nutrition, Dallas, Texas. So thank you very much, ma'am. And we are grateful to the Dr. Aparna ma'am, advisor, One World Ayurveda, Bali and Bali, Indonesia. Thank you very much, ma'am. And I express my gratitude to Vaidya Michele Sahasa, head of the department, Nepal. So thank you very much, sir. Thank you on behalf of Vishwa Ayurveda Parishad. And I immensely thank Dr. Neha Avasti, so Ayurvedic Consultant, Foundation, University of Ayurvedic Medicine and Philosophy, Germany. Thank you very much, ma'am. And by seeing you with your young age, your experience is good, great. Thank you. And I thank all respected executive members of Vishwa Ayurveda Parishad and all the national and international audience and all senior and junior members of Vishwa Ayurveda Parishad. So thank you very much.
Now, thank you, madam, for the concluding remarks, for the vote of thanks. Sorry for the vote of thanks. Now, for the Shanti Mantra, I would like to invite Dr. Mahesh ji.
Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu, Akashit bhavet. Om Shanti Shanti Shanti.